What's wrong? What's wrong, Deborah? Can you talk to me? Are you in pain?
No.
What's wrong with you? Did you hurt yourself? You can't move? Oh, I think we should call somebody, okay?
Science shows that up to 2 million brain cells will die for every minute that a stroke is ongoing, that the brain is without oxygenated blood.
I just came back and my sister's having some medical emergency. I don't know what's wrong. She can't speak to me very well.
So that really underscores the importance that stroke is a time-critical event.
Pre-hospital providers play an enormous role in ensuring that we get people from their homes in a timely fashion to a place where we can actually order the studies, get the test done, get the team on board that needs to treat this, and do it all within 4.5 hours.
For me, grab my hands. Can you raise this hand? You can't raise this hand. Can you squeeze my hand for me? You can't. Oh.
And the identification of the stroke on scene is very, very valuable to what we're able to do in the hospital and being able to get our team ready in the hospital to provide the best care for that patient.
She has vital signs of 195 over 115, pulse of 90. She has a positive for a fast exam, and her LAM score is a 4.
From the pre-hospital side, we are striving to hit a target of 20 minutes or less 90% of the time. What that allows us to do is to quickly identify the symptoms and signs of a stroke, confirm that a stroke does exist, notify the receiving facility, and do those key care elements that make a difference.
Part of what's exciting about stroke care is that it's really evolving dramatically over the past 5 to 10 years, where people would present with a stroke and the emphasis was on rehab, because we really had nothing to offer. Now, in the advent of TPA and thrombolytics, and even more so on the cutting edge is large vessel occlusion management, where we can actually go in and retrieve clot. We're taking people who previously had no options, and now we have numerous options of aggressive therapy that are really getting folks great outcomes that otherwise weren't possible.
It really is an integrated approach and a team approach to care of the stroke victim, from the firefighter, paramedics, and EMTs to the American Medical Response personnel who will be transporting the patient, and the hospital teams that will be receiving the patient. All of those pieces of the stroke system of care need to work together, and when they do work together, when we develop that high level of integration between those 3 elements of the stroke care system, the patient benefits, and we're seeing that through the outcomes that we're seeing here most recently.